Hello, everyone. I'm Dr. Rohan Khanelwal, your Marrow surgery faculty, and I'm here with a budding cardiologist who's just cracked his FMG exam in the first attempt and got an awesome score of 226. So, heartiest congratulations, Dr. Pradeep. How's the feeling in the house?
Sir, actually, my parents are like saying like they are really proud of me, and uh, I'm really happy. I'm like over the like on cloud nine today, actually, from since morning,
So,
and
I'm sure there must be a lot of
like
Bengali sweets in
there's a
the
party
house
mood in the
today.
house. Yes, sir.
A lot of Bengali sweets in the house today.
Yeah, the rasgullas.
Great, great. That's amazing. So, Dr. Pradeep, why don't you tell us something about yourself? Where did you do your undergraduation from? And when did you start preparing for your FMG exam?
Sir, actually, I had started. I graduated from Shahid Sarwadi Medical College, which is in Dhaka, Bangladesh. And
Hmm.
sir, actually, my real preparation for FMGE started from like July 2019, when I took subscription of Marrow, and like I kept doing all the videos one by one since then, and I had no like
Sorry.
specific targets at that time in my mind, other than like focusing on the big subjects which are present in FMG, which carry more weightage, like pharma, patho, and then micro, and then we have our like in the final year itself, and then there was surgery by user, and then medicine and gynae. These subjects actually carry a lot of weightage, like more than 50% of the paper is comprised of these subjects itself. So sir, like I started preparing from pathology. I did all the lectures, and there is the special section, FMG section of Marrow, which has reduced the length of some of the videos and has curtailed some of the videos to like basically put selective emphasis on some like topics, and I did them as well. Like I focused and on doing completing all these videos so that they would give me an idea, and then I kept doing the question bank modules as well aside along these, and like
Sure.
whenever there was.
Pradeep, we'll come back to the question bank module. So, you said that since final year, you've been using Marrow as your primary source of preparation.
Yes, sir.
Did you utilize any other resource as well for some other subjects, or it was only Marrow? You watched all the
I
19
I,
subject
I
videos?
completely used just Marrow, nothing else.
Okay, perfect. And were you able to see all the 19 subjects, or like you said, you were being selective in seeing only the high yield subjects which are there?
Sir, actually, firstly, like I would say, I focused primarily on the big subjects, the high
Hmm.
yield subjects, and
Right.
then as soon as I got like thorough with those topics and those like subjects, I kept on moving to the other subjects as well. Then I moved on to biochemistry, like by Dr. Rebecca ma'am, which like really became so easy for me later when I actually attempted the exam. I could understand like this has become like a stronghold. And then physiology by Krishna Kumar sir, and then I kept doing anatomy lectures as well, as much as I could, and I made sure that I like basically I wrote down my own notes in the beginning,
Hmm.
and later when I thought like probably I would not be able to complete all the subjects before my FMG, then I got the Marrow notes, and I read as much as I could for all the subjects, and I would
That's
say
great.
this really, yeah, this really
So
helped me later
basically, yes,
in
I'm
my
sorry. So
revision.
uh, so you did all the 19 subjects. You started with the main subjects, and then you moved on to the shorter subjects as well. But you did
Yes,
all
sir.
19 videos. And another very important point which you made, that if you make your own notes, if you have time, you always retain them better. But if you're
Yes, sir.
running short of time, you can always trust the Marrow notes as
Yes.
well. So I know in all 19 subjects have been taught really well in Marrow. But any favorite faculty, one or two faculties whom you would like to acknowledge during this interview?
Yes, sir. Definitely medicine by Dr. Rakesh Nair, sir. Like he made me first time. It was like previously, sir. I started with your videos, and you actually made me fall in love with surgery. Honestly, I thought like surgery is really a difficult thing, just like anatomy, how we feel in the first year. And then
Right.
slowly I understood when I did Dr. Rakesh Nair's videos, like he made me fall in love with the subject. Actually, like my preference for medicine, by I wish to take it as my future subject in NEET PG if I crack it later. And it was Dr. Rakesh Nair, sir, and his quotes at the end of the each module or each video, like he does not just like basically teach us. He also just as a mentor, he guides us. And same
Right.
goes to you, sir, as well. You put up these beautiful
Thank you.
like quotes and pictures at the end of each module, and I really love doing the surgery part from. And I, as
Thank
soon
you.
as
Thank you
each
very much.
edition comes up, I first do your videos.
Thank you. Now, I'm sure Dr. Rakesh has instilled that love for medicine in a lot of students. Now, one question I have here is that a lot of students say that his videos are a bit lengthy. So, did you do the regular videos or did you do the Med 80 in which he's concise medicine in 80 hours?
No, sir. Actually, I did not trust that Med 80 part, and I had a lot of time during the COVID in 2020 during lockdown. So I basically
Right.
did all the video at that time. I just did all the videos at 2x by Dr. Rakesh Nair, and also alongside I did Dr. Sakshi Ma'am's gynae.
Great. So, Pradeep, I also want to know that you graduated from Dhaka, and there you told me it's a government medical college. So, the exposure must have been very good as well. And how much of a difference does that make? Because we interact with a lot of FMGs, and sometimes they say that the clinical exposure in certain countries is not there. They're not allowed to go to the theaters. So, that curtails their clinical exposure. Would you say that the amount of clinical exposure which you got in your college also made a difference?
Actually, sir, it did. I would say it did because even though we lost almost a year due to COVID, but
Right.
after that we had to cover that part up in the entire 1 year up in 6 months. I would still say the amount of exposure we got, because our hospital, the college I graduated from, its hospital boasts of like admitting 1,500 patients per day. It's like the third
Wow.
best hospital in the country. Okay, so
Great.
like
Great.
basically, I would say definitely it has like made great students even before, and like it does help us
Make a
like
difference.
remember and stuff. Because I would say, sir, if we read something and after that, if we go in the clinic and see
What?
that patient, that retains the memory forever. Actually, we never
Absolutely.
forget that.
Absolutely. So, which is what we tell to all foreign graduates. If you're in third, fourth, fifth year, please don't miss your clinics. So, whatever you're learning from us, if you can see that, it would help you in retaining the things better, as Dr. Pradeep highlighted. So, Pradeep, what about questions? Were you doing questions immediately after reading or watching the video module, or were you waiting for a few days before you attempted the Q bank of that topic?
No, not exactly, sir. I would exactly first I would watch the videos.
Mm-hmm.
Suppose in the beginning I used to get tired by watching lengthy videos, but so then what I did is like after each video or like a small topic, I used to study those from the notes and then complete the question bank module there itself. And then later, 1 week later, I would come back and revise those and reattempt the whatever went wrong over there. Later, when I slowly went up, like I had got into the habit of watching the videos, I used to like use like a system. Suppose in surgery, suppose a breast cancer, like a system, I would
Right.
complete all the videos, then I read the notes, and then I would do the question bank. And slowly after that, I
That's
would attempt grand tests as well.
So that's a very interesting thing which you've highlighted, that you can do a system and then you can approach the question. So that would also test your mid to long term memory, because it'll take you a few days to finish that system. So that's also a very good approach. And Pradeep, I mean, when you were approaching the Q bank in the last few months, did you have a number in mind that you would want to do at least these many modules every day, or a certain number of questions every day?
Sir, actually, the thing is, during after revision, I like basically as much as my energy permitted, I kept doing all the question banks, so that I had this target in mind that later when I come back, like to revise again whatever went wrong in this question bank, so I would understand, like if I had attempted, like suppose 300 questions, the chance of me getting wrong, suppose it's 50, then I would come back to those 50 questions. So if I attempted more, like 600, I would get 100, like suppose 100 wrong MCQs. And what if those topics are tested in the exam? So I would say, like basically as much as possible we should try to do the MCQs and then bookmark the like errors we have attempted, or the questions suppose we have not been able to understand this topic, or maybe it has come from a different something we don't even know of. So I would like
So the
bookmark
Q bank
this.
which you were doing, Pradeep, were you doing the NEET PG Q bank or the FMG Q bank?
Sir, firstly I started with the NEET PGQ bank. I did it till the end of last year 2021, and after that I switched to the FMG part, and then I kept doing it just for the last 2 months or so.
Right.
That
Did you
became
appear for
easier
the
as well.
Marrow mock test as well, the FMG mock test? Did you appear for that as
Yes,
well?
sir. Yes, sir.
What was your score in the Marrow mock test?
Sir, the last mock I gave, it was like my score was around 235 to 40. And
So it was almost in lines with what you've scored in the final exam.
exactly, sir.
Great. So that's what we recommend to everyone, that these Marrow mock tests, which are free for all, everyone should appear for them. It will give you a good idea where you stand, and you can gauge your performance and then act accordingly. What about the paper this year, Pradeep? A lot of students were saying that it was more challenging than last time. It was more conceptual. Questions were more clinical. What are your thoughts about it?
Sir, actually, frankly saying, yes, the question was like kind of average. It was not on the easier side as well, but I wouldn't rate it as very difficult as well. It was like on the average, as we would like. Basically, some questions were tricky. I would say like 25 to 30 questions were tricky, and the rest like they were average. Like not the exact like easy part we get very easy or like a P, and not very difficult either. I would rate it as average.
So some students were saying that the typical topics which were asked from subjects were missing this year, and they were asking questions from other topics which they were routinely not asking. Was that the case?
Yeah, actually, yes, sir. The thing is, they ask very less these image based questions which we get generally. Like in previous papers of FMG, we get like a lot of image-based questions, but this
Hmm.
time very less were asked, and like mostly we got image like this images of our radiology and stuff, which and I did all these modules of Dr. Mayur Arun Kulkarni from, yeah, and he like really made radiology easy for us. And I would
Absolutely.
say like radiology is also like a must subject for FMG, which people generally ignore, because radiology forms the basis of like diagnosing in most of the clinical specialties. And even if like uh, a normal question is given in surgery, mostly they combine it up with radiology.
Radiology. That's correct.
You know,
So, I mean, it is integrated with almost every other clinical subject. So one should
yes,
not
sir.
ignore
This
it
this was
because
exactly the thing. So this time it was integrated. Like the questions in medicine were integrated with pharma, biochem, sometimes pediatrics, and surgery generally it is like they have integrated it with radiology and like gynae also. About the it was like the same thing. Everything is integrated. This.
So were you confident after stepping out of the center that you'll crack the exam?
Yes, sir.
Great. And
I
were
was.
you confident you'll get a score of more
I
than 200?
Yes, definitely, sir.
Great. So I think so that confidence stems from the fact that he had prepared really well. He had done a lot of questions, he practiced a lot, and that is what gives you the confidence. And I'm sure when you appear for mock tests and you're consistently getting more than 200, that also instills a sense of confidence
Yes, sir.
in oneself. How frequently were you appearing for these mini tests or grand tests from Marrow?
Sir, I would say in the beginning I was kind of lag, and like I used to appear for them like whenever I had free time, or like I was thinking like some days it was tough for me. Like suppose I had like basically I was tired of studying, so then I would sit down and I would like attempt all these questions, just having like a thought in my mind that later might help me out, and I would bookmark all the incorrect MCQs, and I would study them and also revise them later so that they get embedded into my memory. And what
Great.
happened is like at the end, I did as many MCQs as possible and as many grand tests and mini tests as possible, so that like even if something there is like which is repeatedly tested and I don't know about it, so that that does not miss out. I don't miss out on that.
Great. So, did you used to watch the videos at 2x or 1x or 1.5x?
No, sir. Repeatedly, I used to watch it at 2x. And it becomes a
So
habit, sir.
does it sound strange when I'm talking to you at 1x right now?
Not really, sir. Because we are talking about different stuff, sir. The
No,
thing
I'm
is,
sure
there is
everyone will
also,
listen to the interview in 2x only. At 2x only, they listen to the interview.
yeah. So what happens is exactly like when we in Marrow, actually, when we watch it at 2x, even if like someone misses out, for instance, on something, we are still, sir, you are still writing the thing up. So basically, and also we have the notes,
Mhm.
which is available online alongside the module as well. So we won't miss out, or we can just rewind back and watch it.
Did you go through the revision videos and the HYT Delta videos in the end?
Sir, I actually went through the revision videos, but Delta videos I was not able to watch.
Perfect, perfect. So, Dr. Sandeep, tell me 5 tips which you would like to share with your juniors who are going to appear for the December exam. They have around 5 months left. What would be your strategy in these 5 months so that they can crack the exam?
Okay, so firstly, I would say they should start preparing like dedicatedly as soon as possible, first thing, and they should first target the big subjects,
Right.
provided they have good
Can you
concepts of
name
the
those
other.
big subjects?
Yes,
Those
sir.
which you said that
Firstly,
you
we
were selective. Yes.
Yes, sir. Firstly, I would say PSM, which needs a
Mm-hmm.
lot of revisions and all. PSM carries a lot of weightage, sir. Pharma alongside
Mm-hmm.
medicine. These two
Right.
need to be integrated and studied. Then, sir, surgery also, surgery along with radiology. And these
Mm-hmm.
are the three subjects. Then comes gynae and obs gynae. And then, sir, I would say pharmacology is done. Microbiology also carries weightage, and sir, pharma, PSM, micro, patho. Yes, patho, sir. Pathology needs to be
Right.
studied in detail. These are
Great.
the subjects are mostly carrying a
So
lot of
they should
weightage.
first do these subjects and they should not run away from these subjects.
Exactly, sir. There is no
And
running away
then,
from these subjects.
and by doing a subject, you mean watching the videos, reading the notes, and solving the questions.
Yes, sir. Everything needs to be studied about this, like properly.
Perfect. How many, how many QBank modules on an average? Did you take part in marathons and would you recommend that
Yes, sir. I
they
used
should
to do that
also
really.
do the same?
Yes, sir. Actually, the thing about marathon is like when we do it continuously for 30 days, even
Mm-hmm.
if we do it for 20 days, we will get a hang of it for the next 10 days and we will keep doing it. And what
Right.
once we have mastered like a habit for doing it for 21 days, generally it remains with us for life. That's the thing.
Correct.
Like
So
we will keep doing
it's a
it.
habit forming
Yes,
technique,
sir.
and if you can do it for 20 days, then you'll repeatedly keep on doing it, and it becomes a habit. So which is the main purpose behind marathon. Great. How frequently should they appear for mock tests?
So every month, like whatever subjects they have done, like they should appear for those. Like every month, at least 2 to 3 mock tests should be done. Every week, I would say, like, sir, if suppose I complete a subject now and then I study the notes and then I would go for the mock test as soon as possible. And not just one, I would say like 2, 3 mock tests is like good. Because those questions which I will get wrong right now, those questions I can review later if I bookmark them. And then I would just review, because the last 7 days before the exam, nobody is able to study all the 19 subjects completely. So I need to focus on what I will be revising on the last 7 days, sir. So for that, I
What did
need
you revise in the last 7 days?
Sir, actually, I did the revision videos and I saw whatever mistakes I have made in my MCQ modules
Perfect.
and also
So
the
revision
tests. That's
videos
it.
in the end and your bookmarked questions is what you did.
Yeah.
Perfect. So I think so that's great advice, and thank you, Doctor. I think so. It's been a pleasure talking to you, and thank you for sharing your tips with all the students. And I wish you all the best. I hope you crack the NEET exam and get into medicine as soon as possible.
Thank you so much, sir.